Hello, professionals. This is Dr. Saad, and as you know, we are recording series of lecture for pharmacists who are going to appear for international equivalency exam. So, new viewers are requested to go and watch our previous videos for getting our preparation plannings. So, let's resume our topic and the topic is remaining part of autonomic nervous system. We are about to terminate this topic almost. We are about to terminate this system. Just I think so. It's second last our recording. So let's start. Our point number one is about the alpha receptor. Alpha receptor causes vasoconstrictions. So we use this effect specifically for the orthostatic hypotension. Point number two is about the open angle glaucoma. As you know, the neostigma, pyridostigma, and demicarium, and ecotherapate. That's example is that's also known as the phospholine. It is a drug which we use to increase the level of acetylcholine which causes meiotic, which acts as a meiotic agents, and ultimately it is used for the management of open angle glaucoma. Here I want to also tell you about an interaction which we have already discussed in previous video that succinylcholine, which is also known as succinylcholine, it's a neuromuscular depolarizing agent. If we use in this phenyl phospholine user or phospholine user, it will cause phospholine cause increase this level of succinylcholine or succinylcholine. So it can leads toward patient towards the apnea or even death. So this combination should be avoided. Second, point number three is about cardiogenic shocks. Cardiogenic shock, as you know, that our heart is not can't pump sufficient blood to cope the need of body, and to norepinephrine is a logical approach to for its treatment, and in them dopamine is being chosen because it has dose dependent effect. Like at higher dose, it stimulates both alpha and beta receptors, which is enough for its management of cardiogenic shocks. Point number three is about our adrenaline. Adrenaline is for just information that adrenaline is metabolized by the monoamine oxidase inhibitor, monoamine oxidase, and any drug which inhibits this monoamine oxidase and hormone, which it will lead to increase the level of adrenaline, and it can cause towards the side effect. One of its example is the phenylephrine, and if you use phenylephrine in Pargilin users, then it will lead towards the increase in level of phenylephrine, which will ultimately cause hypertension. And as we discussed in a previous video, a case study that a patient was given or prescribed with a cold remedy. It was included antihistamine, acetaminophen, and aspirin, but phenylephrine wasn't prescribed because patient was Pargilin users. So this was all about this point. Next point is about the. It was just information that somatic nervous system and autonomic nervous system are not identical. They are two separate divisions. Point number eight is about the vagus nerve. Vagus nerve is a major nerve of parasympathetic nervous system, and it is specifically used to control the immune system, digestion, and heart. So it's our point, which I want to tell you here that vagus nerve stimulation doesn't cause vomiting. So anything which stimulates this vagus nerve, patient wouldn't go in the situation of vomiting. Point number nine is about some drug that is the beta 1 agonist. It's known as dopamine. It's a positive inotropic agent. Point number 10 is about the acetylcholine chemistry. It's an ester of choline. That's why it's known as acetylcholine. Point number 11 is about the precursor of dopamine. We have two precursors. Number one is the tyrosine. Number two is the levodopa. But levodopa is more closer because according we use this drug for the management of Parkinson disease to increase the level of levodopa. So point number 12 is about the parathione polydioxin. Parathione polydioxin are antagonized to each other. Parathione is an example of organophosphorus poisoning, which is specifically used for the insecticides. But once a human is accidentally exposed to this situation, then we use its antidote, that is the anticholinergic drug. Its example is the palidoxim. And we have already talked about this technical point. So point number 13 is about the is just an information that how protein can be damaged. Protein can be damaged by either deamination or oxidation. Point number 14 is about the tubocuranium. It's a muscle relaxant, and its mode of action is it blocks the postsynaptic ganglia. As you know, ganglia is a point where nerve meets, and if anything blocks there, it easily blocks the information of the information that coming from the central nervous system. So we used tubocuranium for the management, for the relaxation of muscle through blocking this ganglia. Point number 15 is about the intoxication of atropine and acetylcholine. Atropine and acetylcholine are antagonists to each other. Atropine is, we will specifically again revise one thing. They are both, for example, if you talk about the intoxication of acetylcholine, it will cause excess salivation, it will cause mydriosis, it will cause meiosis, it will cause excess salivation, it will increase sweating, it will increase the GIT motility, it will increase the causes urinary incontinence and urgency. So atropine has once a patient is exposed to atropine intoxication, then it has opposite effect. Like in mouse, it cause xerostomia, it cause mydriosis, it cause dryness of skin due to less activation of salivary sweat gland, and it cause as antispasmodic in gastrointestinal tract, and it cause retention of urine. So these are the effects which are almost opposite to each other. Point number 16 is about the succinylcholine. Again, succinylcholine is also known as succinylcholine. This drug shows different response into a different patient. Why? This was the question. It's because of the alteration in acetylcholine enzyme. Different, if acetylcholine esterase enzyme, different acetylcholine enzyme is an enzyme which increase the level of acetylcholine. So there's a difference of acetylcholine esterase enzyme. That's why its effect is different among the different individuals. Neostigmine ADRs just like to check the intoxication of acetylcholine. Its ADRs are almost same as the intoxication of acetylcholine because it increases the level of acetylcholine ultimately. Labetalol is a drug which is known as beta 1, beta 2. It's a beta stimulatory drug, beta blocker drug. So we have a talk about it. So this was all about almost a point which we discussed in specifically with the reference to the international equivalency exams questions. So next topic which we will start right now is it's about the therapeutic implication of the ANS drugs, like how we can prescribe ANS drugs for various conditions and their implication patterns and drug classification. So just for a little bit information, I would like to tell you that in upcoming video we will discuss about some diseases like it's the hypertension, orthostatic hypertension, and specifically muscle relaxation, glaucoma, cardiogenic shocks, acute heart failure, urinary urgency, hypertensive emergency, and Parkinson disease and prolactemia. So, uh, just for your information, I would like to let you know that phenylephrine, who specifically use this drug for the orthostatic hypertension, and clonidine is specifically for hypertension. Methyl dopa is a drug which you commonly use in pregnancy. It is also related to this ANS drug, and tizanidine. This is a muscle relaxant. It is also belong to this class, and brimonidine and with brimonidine we have an eye drops for the management of glaucoma. Epoclonidine is also comes under this class, which is used for the management of glaucoma, and dobutamine is a drug, as we discussed, the condition of cardiogenic shocks and heart failure. So dobutamine is specifically used for this situation. Albuterol is a beta agonist, and it is specifically used for asthma. We have its solution nebulizer and tranquilizer, we use it as a nebulizing agent, as a tablet, as an evohalers, and similarly urinary urgency is can be managed by this class, and hypertensive emergency like phenol dopa. It's a drug which used for the management of hypertensive emergency, and Parkinsonism and prolactin It is managed by the use of bromocriptine. So gradually, next video we will come with two things. Number one is the therapeutic planning of, and it's an ANS related drug share in the management of various condition. Number two, we'll discuss the drug classification and summarize this all previous video data in a one video, and then we will move toward the next section of our chapter, that is the central nervous system. Thank you.